Becca, and I'm going to be the occupational therapist for today. Today you're going to meet Harris, a 20-year-old man who was in a car accident very recently. He's just coming out of the acute care hospital, now to a rehab hospital where he's staying with his fiancée Marcia. In the car accident, he was left with a complete T3 spinal cord injury. As a result of the accident, he has a complete cast on his right upper extremity and a cast on his lower extremity. Today we're going to be working on his dressing goal along with teaching him some weight shifts. So let's go meet him.
Hi.
Hello. Hi, I'm Becca from Occupational Therapy. Are you Harris?
Yes, that's me.
Nice to meet you, Harris. And who's this lady right here?
This is my beautiful fiance.
Oh, so you must be Marcia.
Yes.
I'm
Hi.
Becca. Nice to meet you.
you.
So Harris, how are you doing today?
I'm good. I mean, I really want to get up and get out of this place. I mean,
All
I
right.
need to go home and need to start paying for some bills, you know.
So you just came from the acute care hospital, and this is your first day here. Is that correct?
Yes.
So what did they have you doing at the acute care hospital? Did you see any OT?
No, they had me laying down. All I did was lay down. They wouldn't let me do anything else. Couldn't even change a remote.
Alright.
Nothing.
Gotcha. I see that you're in two casts right here, both on your right side. Are you having any pain today?
Not really, no. No pain. Just like the occasional, like, itch. Really.
Okay. Yeah, that's normal with a cast, and in time you'll be able to get that off. So it seems like you're really motivated to get home, and that's great because as an OT, my job is to help you get back to what you want to be doing. So my goal is to get you home as quickly as possible as well.
Right now, I want to be putting that tux on, you know. Really.
Oh, yeah, I heard that you're getting married soon. Is that
Yeah,
correct?
in the spring.
All right. So in order to be able to get that tux on, you need to be able to dress yourself independently. And since you said at the hospital before they're doing all the dressing, we want you to be able to do that as best as you can. I know it's probably a little difficult right now because you have the casts on. So I'm just going to see how you do and then give you some pointers to make things a little bit easier for you.
Okay,
So
cool.
the goal here for me is to get you independent in doing all these things. So first we're just going to see how you do. And is that your jacket?
Yeah, this is coat.
Okay, great. All right, so I'm going to take out the lateral supports for you. Marcia, would you be willing to take that one out
Sure.
there? Okay. All right, I'm going to support you here in the back.
Okay.
All right, help you get into position. All right, so I'm just going to have you place the coat or give it to him and just see what he does. Okay.
Ready?
I'm ready.
Okay. Can you push me forward?
Yeah.
This is a lot harder than I really thought it was going to be.
I know, it's because you haven't been dressing yourself lately.
No.
All right.
All right.
Do you think
just
you need
push
some
me
help?
back. Yeah, I need a lot of help.
Okay.
All right.
So I'm going to give you some advice that's going to help you out a bit more. So what you did first is that you put your coat on your good arm. I'm going to have you put your cast, the arm with the cast, in first, and you're going to use your good arm to help you get it over.
Okay.
And then it should be a lot easier that way.
Okay.
Let's give that a try.
All right, push me forward.
Yep.
Oh,
All right.
around. Where's the hole?
Need help?
Oh, yeah,
Got
give
it.
me forward, give me forward. All right, now up. Sweet.
There you go.
Almost perfect.
You're getting there.
Was that easier?
Yeah, it was good.
All right, so that's just one simple technique, and things should get a lot easier once you get that cast off in terms of dressing. Like I said, right now, your trunk muscles, you don't have much control there, so the more you practice these things, the more strength you're going to be able to gain, as well as endurance too.
Okay.
Within therapy, we're going to work on these over and over and over again, and so it can become a lot easier, so you'll be able to have some independence again.
All right, yeah.
So
That's what I'm looking
now, great. Do you want to keep your jacket on or take it off?
I think I'll leave it on. Can you help me put the back down?
Yeah.
'Cause it's on the wheelchair. I'm going to try to
Okay,
put
yeah, I
myself
see that.
forward. Okay.
And then you can help him out too. Do you have any questions about dressing? I I mean, basically the main thing I was doing was just help support
Yeah.
him, his trunk.
Yeah, I can do that.
Okay, that sounds good.
Thanks, baby.
Okay, so one thing that you were doing as you were getting dressed was that you were moving around a lot more, and when you move around, you're shifting your weight, and that's something that's going to be really important with your diagnosis, because since you don't have sensation on your butt and your legs, then you are really prone to pressure sores. Have you heard of pressure sores before?
Yeah, I had a real dirty roommate before, and he had sores. It was real. So
From laying in bed.
Yeah, from laying in bed. Yeah, he never got up.
All
It was
right.
pretty nasty.
So you have an idea what that's all about.
Yeah.
So in order to prevent against those things, you need to shift your weight every 30 to 60 minutes. Obviously, the closer to 30 minutes, the better.
Okay.
So I'm going to just teach you guys some simple ways to do that in order to prevent pressure sores, okay? The first one I'm just going to help you with is very similar to what we were just doing, how you were asking me to help lean you forward. That's the exact thing what it is. It's just leaning forward to get some pressure from off your butt and transfer it more onto your legs. It's distributing the weight. So I'm going to do it with you, and then just for a few seconds, and then Marsha, I'm going to have you get over here and do it too, so you can get an idea of what it feels like and what should be happening. Okay. Does that sound good?
Yeah.
Okay. So what I'm going to do is you're doing the work. I'm just supporting you in whatever way you need.
Should I try and pull with my hand? And
Yeah,
push it forward?
however you can get down. The goal is to be as far down as possible. And I know you don't really have the stability right now, but eventually you should gain a little bit more.
Okay.
Okay?
All right, cool. Let's
So
do
I'm going to
this.
support you and
All right. I don't know where to put my hurt hand, but let's just go.
that's good.
Oh.
How does that feel?
It's there's pressure in my head, but
That's okay.
that's okay.
All right. Let's get you back up.
All right, let's go.
Okay. Since you don't have your supports in, I'm still
Yeah.
trying to keep your trunk stabilized here. Okay, Marsha, you can come over here now. So what I'm doing is I'm just keeping my hands right on his chest and his back.
Okay.
I'm letting him do as much as he can.
Okay.
And you'll feel it's weak there, and he definitely needs to be helped up. So just, follow his lead and work together.
All right. Sounds good. Let's try this.
All right, let's do this, baby. Ready? Ready?
I'm ready.
Okay.
So usually when you're doing this, you want to be doing it for 30 seconds at a time
Okay.
to just make sure, you got some relief from the back.
Okay. Bring me up. Should I put my cast arm somewhere, or?
The only real precautions for that is you can move it above your head, whatever you need to be doing. I guess I just wouldn't be putting so much weight on it. So, how you're doing it, you were just keeping it to the side. I think that's okay for now.
Alright.
Did the doctor tell you anything about that cast?
No, you just put it on, and that was.
Okay, then I can talk to your nurse and see what she thinks and give you some more details about that. Okay. So, I'm gonna put your lateral supports back on. So just so we don't have to be supporting you as much.
Yeah, so I'm not slouched over the
Yeah.
chair.
So
all
Marsha,
day.
if you can grab. Oh, you can put them right on too. Do you know how to do it?
Is it like this?
Yep. We're just putting them in to give him some support right by his sides.
All right. Can you lift this?
Yeah, I can lift mine. Just gotta push it in. Oh,
There you go. So some other ways to do some weight shifts are just really simply turning your body as best as you can. So if you can put your arm over here and then just try to shift towards that arm.
okay.
And I know it's kind of hard right now because you're unable to move this leg, but eventually what you're going to be able to do once you get a little more strength and the cast is off is to lift up your leg and physically move it with your upper body.
Yeah.
So you get the pressure off this side.
Okay.
So what I'm going to do is I'm going to give you guys both just a little home exercise program. It has a bunch of different weight shifts on it. Right now I'd start with kind of the simpler ones because of like I said, the cast and the lower cast. It's a little bit harder. You have to have some precautions for those. So this is going to be your go-to. And like I said, you need to be doing them every day, every 30 to 60 minutes.
Okay.
It's very important.
Yeah. Can do.
Okay. So how did you feel about therapy today?
Oh, it was fun. I had a blast.
You had fun?
I had a blast.
Okay.
It was good.
Okay. So,
You think that there's any chance of me being able to go home and do this?
I think that our goal is to have you get home as soon as possible. So, in order to do that, you just need to get a little bit stronger, and we need to educate you about a few things. In the future, we're going to be talking a little bit about your home and your concerns for that. Is there any questions or anything you want me to address right now?
Well, we live on the 15th floor of an apartment, but there's a ramp to get in and there's an elevator. I'm not worried about that, but our apartment's kind of small. Not much room for him to get around.
Okay. Well, what we can do, if it makes you feel better, is we can come in and do a home assessment, look at the home, because maybe it's some simple feng shui that we can do, move things around to make you get around a little better. And just look at your shower and your toilet to make sure everything's okay, and give you some equipment as needed.
Okay.
Does
Will
that
that
sound
come
good?
later then?
That will come later, yeah.
Okay.
Right now, we want to get you moving as much as you can, getting you dressed by yourself, using the toilet, being comfortable using your catheter and whatnot, which I'm sure the nurses have shown you.
Yeah, that was a fun experience.
I'm sure
That
that
was
was fun. Yeah. But I know this is all really fresh and really new, but
It's gonna be a rough ride.
yeah, but you seem very motivated, and you guys really can make this work. So, any other questions today?
No,
All right.
I'm good for today.
Thank you so much.
Okay, so I'll see you guys tomorrow. Does that sound good?
Yep.
Same time, same place.
I'm not going anywhere.
Okay, and will you be here, Marcia?
Probably, yeah.
Okay.
I'm taking some time off of work.
Okay. All right, great. All right, I'll see you guys tomorrow. It was nice meeting you, Harris,
Nice to meet you.
and Marcia too.
Nice meeting you.
All right, and I'll see you guys tomorrow. Have a good one. Bye.
Too.
Bye.
Bye.
Don't